Hi CAM followers, welcome to our live this evening. My name's Meg and we are really pleased to welcome Dr Siobhan Menzies this evening. She is going to introduce herself a little bit more in a moment, but she's a rehab practitioner and chronic pain specialist. So we'll be discussing all things vet rehab this evening. As always, if you've got any questions, then pop them in the comments box, and as we go, we'll try and answer as many as we can. So before I ask Siobhan to introduce herself a little bit more, I would just like to show a short video just on one of the courses that CAM have available at the moment. So this is the Is My Dog in Pain course. It's one of the amazing free resources that CAM have available. It's available on the website, and it provides further support for owners who have just received a diagnosis of arthritis for their pet. Obviously, it can be really quite overwhelming. There's lots to get your head around. So this is just a really nice way to kind of process the information. So vet professionals can refer clients over to the website, and then owners can head straight there. It's a free resource, so it's something that's really helpful just to aid understanding and support following a diagnosis. So head over to the website. There's loads of other free resources and courses over there as well. So over to you, Siobhan, if you'd be able to introduce yourself and tell us a little bit more about what you do.
Thanks, Meg. So firstly, if anybody doesn't speak Northern Irish, please ask me to slow down, or, we can put subtitles on, or just watch some episodes of Dairy Girls, that might help. But so my name's Siobhan. I'm a veterinary surgeon, qualified a very long time ago in Edinburgh. And I've spent the last 20 plus years working just solely in pain management. And I'm really passionate about pain management and rehabilitation. I think it's an area now which is getting the attention it deserves. And it's lovely to see vets and nurses and physios and everybody now starting to work together in a really productive way to tackle this important issue. So I established the practice, I practice HolisticPet in Northern Ireland 20 years ago. We work in conjunction with many of the practitioners in Northern Ireland. We like to think of ourselves as a team with those different referring vets. We have a partnership with a referral practice who have a hydrotherapy unit that we work very closely with. We basically manage it. And so we provide pain management options. So acupuncture is how I started down this road. I started doing acupuncture, found it was really incredibly effective, but that there was still more that those pain patients needed. So I studied rehabilitation with the University of Tennessee and on their CCRP program, sports medicine with the Canine Rehab Institute. And basically, we developed a program that we find works, working closely with our clients, our lovely pet parents. And so I've done that for 20 years. And every time, we get a new therapy, I started looking, okay, what's the next thing? What's the next thing we can do? I don't know, maybe I've got a low boredom threshold, or I just like to always think, well, yeah, we're getting an improvement, but what can we do? What else can we do? What's the next step?
Once you've seen an improvement, you want to see how far you can push that, for sure.
Exactly. But, you're a vet nurse, Meg. We've got a wonderful vet nurse in our team, Emma. I've got a fantastic colleague, Elsa. We've just... sadly, our lovely Sandra has retired, but she's coming back for locums. We're not letting her away with it. We work with a wonderful team in the referral centre in Belfast, and we have Sarah, our sports scientist, and Kat, our vet nurse trainee, doing our hydrotherapy. So yeah, it's a lovely, lovely team that I work with, and I'm thankful every day that I have this, passion in my life that I've been able to explore. And now I'm writing and lectures and starting to teach a wee bit, which I also love. I love kind of imparting the passion, and
Definitely.
trying to guide people into how they can provide a safe and effective therapy for animals in pain.
Yeah, I think you mentioned briefly that it seems to be sort of a new thing that we're exploring all of these different avenues. So yeah, I think definitely lecturing and providing more information is only going to be beneficial as well. So that sounds brilliant.
Yeah, it's good. It's good fun. The energy that our colleagues bring to those courses when they want to learn, it's really exciting, and I think it's the future's looking good. When I started out doing acupuncture, I was the only vet in Northern Ireland. I think one of only 2 or 3 in the whole of Ireland,
Yeah,
and I was regarded with great skepticism and
yeah,
I'm not going to say suspicion, but I was voodoo vet.
yeah,
And I got all the cases, all the last resort cases, but now it's you just work away and you get the results, and vets now refer very actively to us, and we're very grateful of the support of all of our amazing referring vets in Northern Ireland.
yeah,
It's with their support, we really make a difference, I feel, to our patients.
yeah, for sure.
Mm-hmm.
So as I mentioned, any questions as we're going through, just pop them in the comments box and we'll try and answer them as we go along. But would you sort of be able to explain a bit about what veterinary rehabilitation is to you,
Sure.
and for clients, how they can sort of get involved?
Sure. So veterinary rehabilitation is basically using pain relief and physiotherapy to achieve a full return to function after, trauma, injury, debilitation, surgery, even old age. So we use pain relieving, because we're vets, we can prescribe. So we use pain relieving drugs and pain relieving therapies. So we use acupuncture, laser, hydrotherapy, which I know is close to your heart, physiotherapy. Therapeutic exercise is really a big part of what we do. And there's a lot of evidence supporting therapeutic exercise in rehabilitation generally. So we might also use therapeutic ultrasound. We're about to get a shockwave. And each of these therapies, it adds a little bit extra to what we do.
Yeah,
But each rehab centre is different. So some rehab centres, like you had Greg on from Lapslie, he does intra-articular injections. Some might just be hydrotherapy centres. So each rehab centre is slightly different. And I think from my point of view, what I find works is basically throwing as many darts at that pain dartboard as you can, because what works for one patient won't necessarily work for another.
yeah,
So something that's informed my practice over the last 5-6 years is that I've suffered from chronic pain. Thankfully, it's under control. But that was really informative to me, because it gives you great empathy and understanding of what our patients go through, and how that simple pain, that initial pain, which is developed as a protective mechanism. So, we feel a pain, be it, we hit our thumb with a hammer, or we touch something that's too hot or too cold, or we spill acid on our hand, or, the brain needs to know about that quickly in order to withdraw you from the danger.
yeah,
Okay. The problem with chronic pain is that when pain is sustained for a long time, new pain receptors open in our periphery, these pain receptors that lie dormant until they're needed. So they get switched on, and new pain pathways open to the brain. So there's a constant stimulation of the neurological system telling us that we're in pain. And it gets to the point where even non-painful things can feel painful,
yeah,
because the nerves that normally tell our brain about touch start to get flooded with neurotransmitter and start to tell the brain that even a light touch is painful. And this is why so many of our chronic pain patients appear to be overreacting to pain. And it's hard for somebody who's not experienced pain to really get that. And sometimes I have to explain to colleagues, no, the dog isn't overreacting. This is how it feels the pain.
yeah,
This is, its brain is telling us that is really that sore, even if you can't find any pathology. Because very often, we'll do x-rays, we'll do MRIs, we'll do CTs, and we can't find any pathology, because the pain becomes a disease itself in time.
Yeah.
So the injury can heal, the surgery can heal, but the brain still thinks a threat exists, and the brain still thinks that limb or that part of the body is broken, and the brain switches it off.
Yeah.
And the problem with chronic pain is that it starts to affect the emotional center in your brain. So our pets become withdrawn, they become depressed, they might become aggressive. It starts to affect your myofascial system. So your is that your dog?
That's my dog, yes.
Okay. It's agreeing with me, I'm sure.
Yeah.
So it starts to affect the myofascial system. So your muscles, they become tense and tender, and you squeeze the blood supply because you're so tense, and then that makes it even more painful, and you end up in this pain muscle spasm cycle. So you end up with dogs that are depressed, that they have difficulty moving, that their muscles are sore, their joints are restricted, and they don't want to interact socially. They don't want to be cuddled by the owner. They don't want to go for walks, and then they start to put weight on, and it starts to affect the quality of life of the owner and the quality of life of the pet. And it's lovely being able to see that patient for the first time and give that owner hope and say yes. So your pet may be suffering from osteoarthritis, it may be suffering from a muscular injury or strain or sprain, it may have had surgery that it hasn't recovered from, or it may have a neurological disease, or it may just have chronic pain. I say just chronic pain, I've had chronic
Yeah.
pain, but chronic pain itself is now regarded as a disease. And but we can do something for that. That's the lovely thing. We can say, well, we will look at the medications, and we might suggest more medications that might help. We can do some acupuncture, we can do some laser, we can do some massage, we can do physiotherapy, we can do underwater treadmill, we can do any or all of those things. We can give you a home program to do, which is really empowering, because
Yeah.
all of a sudden
Yeah.
you're saying, you can do something to help.
Yeah.
And clients love that. We all love being able to help our loved ones, don't we? Whether they
Definitely.
have 2 legs or 4 legs, being able to think the situation isn't hopeless is a wonderful stimulus to break
Yeah.
that pain cycle. So we see a very wide range of patients. As I say, we've got lots of arthritic patients, which I know are close to your heart and at CAM, but we treat a lot of post-surgical patients. And that's quite a different discipline, because you've had an animal that's had surgery for a specific
Yeah.
condition. Could be a total hip replacement, or femoral hypostectomy, or cruciate ligament. And we as vets, we know intricately what happens during those surgeries. So we know how to bring that animal back to full fitness, and how not to cause further damage. And
Yeah.
that's really important, because you can do more harm if you do inappropriate physiotherapy, you know.
Definitely.
And I think one of the problems we have in the UK is this area is not regulated. So anybody can call themselves a veterinary rehabilitation specialist even. It's not
Yeah.
regulated. We're regulated as vets.
Yeah.
Chartered physiotherapists are regulated. The ACPAT physios, they're regulated by the Physiotherapy Council. But we need more regulation, so that the public can rest assured that the person they're going to see has the qualification and the professionalism that is required.
Yeah. It
So
becomes quite dangerous, doesn't it, if it's,
yeah, absolutely, it can be.
Yeah,
Yeah.
for sure. I don't know if you can see the comments at all, but
I
there's
can't see the comments.
no, that's fine. So there's one from Maggie who says, I used acupuncture last year, but it made my shepherd worse. It made her lame. Is that supposed to happen? She passed 4 months ago due to her lameness.
I would say that that's pretty very unusual. I've never had a situation where acupuncture has made it worse.
Yeah.
So we're not called HolisticPet by accident.
Yeah.
So when we assess a patient, we look at the entire patient. So there could well have been something else. I would suspect something else was going on there.
Yeah.
Basically, acupuncture, they reckon, has about a 75% effectiveness overall for all conditions. For pain, my experience is that it's pretty much 80%.
Yeah.
And there's some of us that are just wired where we won't respond to acupuncture.
Yeah.
It's pretty unusual for it to make it worse long term. What you might experience is that the first time or two you get acupuncture, you can be sore the next day. But that's
Yes.
the same with any physical therapy.
Yeah.
You know, you can be a little bit achy, but then usually the next day you feel better.
Yeah.
So some patients don't get a response until they've had a treatment once a week for, say, 4 weeks. Some are better the next day, and we've got all grades in between that. And some we don't get a response. And in those ones that we don't get a response, I start looking, well, why is the animal not responding? Yes,
Yeah.
it could be a non-responder, but is its thyroid underactive? Have we got something else going on?
Yeah.
Or, you know, is there another therapy we could use to get a better result here?
Yeah.
Because, you know, not everybody's going to respond to the same therapy. But that's why we use multimodal analgesia. So, you know, I started out just doing acupuncture with the aim, the kind of very idealistic aim of getting animals off all pain relief. Well, life isn't like that.
Yeah.
Most of our chronic pain patients are in too much pain. And
Yeah.
so we would look at that and we would say, okay, so we examine the patient. And first of all, when the very first step of that, I like to kind of peek through the window of the consult room and see them in the waiting room. So if it's an old dog, is it standing up? Because old dogs usually lie down. You know, if it's standing up, is it because it can't lie down? Or if I could see it lying down, is it showing evidence of pain? If it's a young dog, is it lying down? Because a young dog should be up and interested in socializing. So we look at how they are in the waiting room, we get them outside and we look at them walking and trotting. We try to assess all aspects. So we're not just looking at the lame leg. We're trying to assess, right, what is the muscle mass in that dog? What is the joint range of motion of all of the joints, not just the obviously lame leg? Because we have connective tissue, and the clue is in the name. It connects. Everything is connected. So the myofascium, which is this amazing structure, a fascium under the skin that connects absolutely everything in this three-dimensional manner, you know, that is, I think, the next big area there's going to be research into. But basically, it connects everything. And just a wee aside, sorry, I keep going off on asides, but wee aside, there's a lovely YouTube video called Strolling Under the Skin, if anybody's interested in the fascium. It's really beautiful, and it's a French hand surgeons made this beautiful film. Anyway, because everything is connected, if you have a lameness in one area, it's, you know, usually after a period of time, you'll get changes elsewhere. So we have to look at the whole animal and figure out, right, what are the animal's needs? They usually eat pain relief. Is it pain relief for neuropathic pain? That's the central nervous pain that I was talking about. Is it a muscle relaxant? Is it just an anti-inflammatory or an analgesic? Or if it's a pain relieving therapy, you know, we can use any of our therapies. But has it lost joint range of motion? And if it's lost joint range of motion, can we correct that with the therapies or with therapeutic exercise? Or has it lost muscle mass? Or is, you know, particularly for our spinal patients, whether they've had surgery or are being treated conservatively, have they lost their balance? Have they lost their sense of where the body is in the world, a thing we call proprioception? So, excuse me, I'll get a wee drink here. Basically, the point I'm making is that we have to look at all aspects of the patient.
Yeah.
So when somebody says to me, acupuncture doesn't work, I'm thinking, well, what else was going on in that patient and what other therapy could we have used for that patient?
Definitely.
You know, because there's, like I say, things rarely happen in isolation where pain is concerned. It has huge knock-on effects in the central nervous system and in the myofascial system. And we have to look at those other aspects or we're never going to treat the pain effectively. And I have treated dogs only with acupuncture, but for a lot of our patients, we need to look at other therapies and multimodal analgesia, using these pain modulating drugs and pain modulating techniques. For me, that's the most effective way. So I'm really, really sorry to hear that the acupuncture didn't work. I think it's unlikely the acupuncture made it worse. I think possibly something else was going on. I'm really sorry to hear that you lost your dog due to lameness. And that's, you know, where the rehab centres hopefully can help make a difference.
Definitely.
But, you know, sadly, we can't save them all, you know. One of the nice things and sad things about what we do is we see a lot of our patients weekly, monthly, every 6 weeks for years. We get to know those patients so well, you know. They're like our extended family pets. And you know, we've lost some of our golden oldies recently. You know, a lot of our they're all special, but you know, it's hard for us when we lose those kind of long-term patients. And you know, it's yeah, as pet owners ourselves who've lost pets, you know, we can really feel for that lady who's lost her wee dog there.
Definitely, absolutely. So what would you say condition wise do you see most often? Do you have a condition that you see most often, or what kind of patients would you say would benefit from the veterinary rehabilitation
so it's a very wide range of patients. Like I say, a lot of arthritis, a lot of elbow dysplasia, a lot of hip dysplasia, because we know how debilitating those conditions are. We see a lot of dogs which have had surgery, particularly cruciate surgery. That's one of the most common surgeries, but also hip surgeries. Excuse me. We also see, we're seeing more sporting dogs. That's really interesting.
Definitely.
So a lot of sporting dogs will have muscle injuries, they'll have tendon injuries, and they're quite exciting to treat as well because their owners, well, all our owners are committed. But, you know, you'll see a sporting dog and they'll say, well, you know, I'd like you to concentrate on increasing the muscular strength in this area. And, you know, those owners are really committed and they'll come back 3 weeks later and those dogs are really buff, you know, they've worked so hard. And, you know, we've got some sporting clients and it's just lovely seeing them progress. And they all love the sports. The dogs love the sports, the owners love the sports. So we treat a lot of dogs with neurological conditions, a lot of post-spinal surgeries. And that is one of the most rewarding things we do.
My favorite too.
It's your favorite thing.
Yeah.
You know, you get a dog and the surgeons have done their amazing job. I mean, I just totally in awe of the surgeons. They do an amazing job, but because of the nature of the disease, the surgery on its own doesn't get them back up on their feet. And that's where we come in and you have a little dog that can't walk and you just work with it, get to know it, you know, how to encourage it. And, you know, maybe a week, 2 weeks, 3 months later, you get a wee dog walking. There is nothing like it. It's endorphins, it's adrenaline. You know, it's so exciting. I got a lovely message from my nurse yesterday. I sent a message out to our group and I said, I'm really in the middle of something. So please don't send me any messages. And literally 3 minutes later, I got this excited message from Emma going, MM has just run in. She's just run into the building.
Yeah, it
okay, I'm
means
going to
the
forgive
world,
you.
doesn't it?
I'm so happy that is walking and running again. I'm so happy. I don't care that you completely ignored my request not to interrupt me. But that's what we get really excited because it's so rewarding. So that's our spinal patients, you know, as I say, they may have had surgery. Then we get spinal patients which aren't suitable for surgery and we work with those. We get a lot of dogs coming with behavioral problems, you know, because they may become anxious or aggressive and the clients want to know, is it because they're in pain? Some of those are and some of those aren't, but that's quite challenging and quite interesting to work with. So I'm just going to put the heat on here. It's getting really cold. So I've been having some electricity problems, as I said. But dogs which have had injuries, dogs which have degenerative diseases, those are quite tough. You know, the dogs with degenerative myelopathy, because those are progressive.
Yeah.
But at the same time, you know, there was a study which showed in German Shepherds with degenerative myelopathy that using intensive rehab could increase their length of life. So you're not going to reverse that condition, but you can help the animal live with the condition. And that's the key thing, is just making them comfortable, improving their quality of life,
Definitely.
and, maintaining the mobility that they have. Yeah, so it's very wide. No two patients are the same. It's a very wide range of conditions. And then, of course, we have our golden oldies, which come in for palliative care.
Yeah.
They're just adorable, with the most committed owners ever. And,
yeah, absolutely.
Yeah, so that's yeah, it's like I say, it's never boring. It's usually very busy and quite stressful to get through everything during the day. And we have to ask our clients forgiveness when we don't get our therapeutic exercise programs out to them, for a day or two, because we've been so busy. But yeah. It's good fun.
There's a lovely message here from a lady called Nikki, who said that you and your team have been treating her 10-year-old Newfoundland for the last couple of years, and that you're all fabulous, which is
hi Nikki. Really I know Nikki.
Yeah.
Yeah.
And it makes it all worth it then as well, when you kind of you see the owners kind of see the change in their dogs and cats as well. It's lovely to have that kind of rapport with
absolutely
them as well.
And thank you for mentioning cats. Can we please get more cats to the rehab centres,
100%.
acupuncturists? And the incidence of arthritis in cats is really high. But because excuse me, I'm talking too much, aren't I?
No, you're fine.
You just give me a room full of people have to listen to me, and I don't shut up, so I apologize. So basically, cats, because they're both predator and prey, whenever they are lame, they don't want to advertise that, in case they get attacked. So what they do is, when they're sore, they just sit, and they don't give it away. So this is where we have to be more attentive to cats. Dogs are more obvious. They'll come along and they'll go, hello, my leg's sore. Where a cat, it'll go, nothing wrong with me. Just walk on by, because they don't want to be attacked by their competitors. So they tend to hide the pain. But we have some lovely feline patients, and believe it or not, their cats are really responsive to acupuncture. I find cats and horses, they can be, sometimes some of them don't appreciate the intervention as much as dogs do, but when they respond, they tend to respond really well. Whereas dogs, you can usually persuade them to let you do acupuncture.
Definitely.
It's rare that we can't do it. But yeah, it's we need to see more cats, because cats suffer pain too. It's just not recognized.
Definitely. It's something that we find sort of a lot as well, is that it's massively they're just underrepresented, I guess, for
pain. They really are.
Definitely. Another lady here has said, my Mastiff has really swollen hocks. He's been on Librela, which I think worked for the first 2 to 3 injections, but not really much help since. Vets have now started gabapentin and Previcox. What steps would you recommend for him? He's a very young 9-year-old, but his body lets him down.
Okay, so what I would always say is, motion is lotion. Okay, we've got to use it and lose it, but you've got to find a therapist who can help you move your lovely dog in a controlled manner, so that you don't do harm. So sounds like your vets are on it with the meds. That's perfect from a medical point of view. You could be doing massage yourself at home. There's a little video of me doing a massage on a collie that I saw for the first time. On our HolisticPet website, you're more than welcome to view that. But we'd be looking to see, okay, so it'll have lost joint range of motion in the hocks, and that will have a knock-on effect on the other joints of both the hind legs. But also what he'll be doing, he'll be shifting his weight to the front. So when you're doing the massage, you really need to concentrate on the muscles of the front legs and the back, as well as the back legs. You could, I would definitely keep him on the lead when you're walking him, so that he doesn't do any uncontrolled or high impact exercise. High impact exercise is the enemy of arthritis and pain. Controlled exercise is the friend, okay? So if we keep moving, we can keep stimulating the muscle and the brain and release endorphins in a very good way. But high impact is a jarring effect, and it kind of causes what we call muscle inhibition, where the pain basically switches the muscle off. So massage,
Typically.
and if you want to, that's okay, once out, that's fine.
That's my dog demanding water. Nothing's ever simple with animals, so bear with me.
That's allowed.
Sorry, carry on.
Yeah, so basically from a home management point of view, you can apply heat to any sore muscles. I wouldn't apply heat to the hocks. So, but heat before massage helps because it increases the blood supply. So heat, massage, controlled exercise, and then after the exercise, you can use an ice pack on those hocks. So both hot packs and ice packs should be wrapped in a towel so they don't cause an ice burn, or a burn. You don't want to leave them on for too long. But that's a pretty kind of generalized, simple home therapy program that I could advise. Any pet owner of a painful pet, but really you need to find a therapist who can help you. You might find somebody on the acupuncture sites. There's the Association of British Veterinary Acupuncturists. There's the British Veterinary Rehabilitation Sports Medicine Association. So there's various associations will help. Have a look for a hydrotherapy centre, because hydrotherapy can be really effective, okay, in getting these and maintaining the mobility of our patients. So what happens in hydrotherapy is that the buoyancy of the water lifts the body up, and then if they're in a treadmill, we principally use a treadmill because it's more controlled. And certainly with a dog with severe arthritis, I wouldn't go to swimming without seeing a therapist first who can advise you as to whether that's appropriate. In the underwater treadmill, it's more controlled, and you can get nice low impact exercise going there. But really a therapist who provides some of the pain relieving therapies, be it acupuncture, be it laser or hydrotherapy, might be able to give you some pointers there and help keep him moving. But the key is really keep him moving, keep his weight down.
Yeah.
Don't overfeed when the mobility is low. Typically, I'll be telling owners, if they're not as active, you want to kind of cut back on the food by about 20%, and you can bulk it up. For most dogs, cats are not cats, but most dogs will tolerate some veg as a bulking agent, or some, apples and carrots as treats to replace those kind of high calorie treats. Yeah, but basically, anybody she can find to help her keep her pet mobile. Ask her vet. Her vet may well know a physiotherapist or a rehab vet in the area, or a hydrotherapist who they have confidence in. I think that's the key thing. Find somebody that that you can have confidence in.
Yeah. So that kind of answer feeds into another question from Kelly. She said, how can you find a good holistic vet? I asked to be referred for physio and hydro, but it wasn't recommended. My experience is that vets only really recommend things that they offer rather than refer out. She did say, though, that they were happy to refer when she asked, but they just didn't suggest it themselves. Is that something you find often, or how would you suggest to find a good holistic vet?
Yeah, I think that side of things is changing. I think vets now are kind of becoming more aware of what rehab can do. I think what you've got to appreciate about vets is that if we refer a patient to another therapist, we are really liable for that. And that's where we're in a very difficult situation. So they won't want to refer to someone that they don't know what it comes down to, because ultimately that's their patient and they're responsible for the health of that patient. And rather than being protective of their business. I think they're more being protective of their patients. They're trying to do the right thing for that patient and above all do no harm. I think I'm working with the lovely people at the Veterinary Osteoarthritis Alliance. We're trying to create a scheme where we can have physiotherapists affiliated to the VOA, and that should help, I think, help clients. Excuse me. There's a register called the RAMP register, the Register of Animal Musculoskeletal Practitioners, and that has lists of different therapists and their qualifications. So that's really useful. There's the ACPAT register. That's the Association of Chartered Physiotherapists and Animal Therapists. So they're kind of the gold standard in animal physiotherapists and veterinary physiotherapists, because they haven't just done a full charter physio course. They've then gone on and done another few years of study on the animal side of things. So that's the ACPAT register, ACPAT, and the RAMP register. And I think ABVA, the Association of British Veterinary Acupuncturists, will have a list of the acupuncturists. The for the holistic side, there are herbal groups and homeopathic groups as well. British Association of both homeopathic and herbal veterinary surgeons. So those are, other people that come at it from a holistic point of view.
Definitely. And I think this lady did mention that her vet were happy to refer when she asked. So never be afraid to ask as well. Could I be referred for?
Exactly. Yeah.
Yeah.
It's your pet.
Yeah.
Do you know your pet?
Yeah.
You know if your pet's not itself, if it's in pain, if it's not well. That's the thing you learn as a vet as you get older, is to pay more attention, to listen to the owners.
Yeah.
And but yeah, you're the only one that can speak for them. So if you wanted to get more therapy, you just ask the vet.
Definitely.
And the more people that ask the vet, the more the vets will say, well, maybe we should be providing these therapies, or maybe we should find someone that we trust to provide the therapies. And I think that's the key thing. And, as I said, it's becoming a more common therapy, and that's only a good thing.
Yeah. And as you said, vet practices are building more relationships with rehab practitioners that then they'll be more confident to refer to. So
yeah, the multidisciplinary team is really what we're trying to promote.
Yeah.
So that, you've got the vet, they might work with a hydrotherapist or a physiotherapist. Their vet nurses might do their in-house physio. It's a team. Because each of us have our own strengths and weaknesses.
Yeah.
Excuse me, I'm just going to blow my nose.
Oh, you're fine. Just having a look at another comment. So Ruth says, could you tell me about ideal treatment for lumbosacral disease? She's got a 12-year-old, I presume, dog, she doesn't mention, diagnosed with it recently on Librela. What else would you suggest for lumbosacral disease?
So for lumbosacral disease, it does, we treat a lot of lumbosacral patients with acupuncture because they will get a lot of pain in the muscle in that area, the longitudinal muscles of the back. So the acupuncture is very useful for relieving the muscle pain. But again, we would use hydrotherapy as well, because it makes it easier for those patients to move. Sometimes with lumbosacral disease, you'll get the nerves being squeezed, so those dogs start to lose their sensation in their feet. So sometimes they scuff their feet over. Sometimes they have a more tendency to slip. And this is where the wonderful advice that you guys give on, making sure the surfaces are non-slip, using ramps, using, you can use, I'm not a big one for the boots, because I think they can be quite heavy, and, it's quite difficult for a dog that's weak in its hind legs to cope with a heavy boot. But a non-slip sock, or some of the little latex socks that are non-slip, are quite good for, giving them a little bit more grip when they're walking.
Yeah.
But again, this is my top tip, you know, motion is lotion. Use it or lose it. You've got to find a way to keep them moving in a controlled manner.
Yeah.
If they do less, they will be able to do less.
Yeah.
So we try to keep them doing as much as they can do, but we don't push them beyond that. So again, it's getting a therapist that can advise you on the right type of exercise, because there are a lot of therapeutic exercises that can help, because you want to keep the hind limbs strong. So we would choose exercises that would keep the hind limbs strong. Again, thinking about where the compensation for that condition is. So that dog would be shifting its weight to its front legs. So they'll start to get sore and tense. So again, you want to be massaging the hind legs. Massaging the entire body, but really focus on the hind legs and the neck, because that'll be taking a lot of the stress. Strengthening the hind legs and relieving the pain in that lower back. So acupuncture can help relieve the pain in the lower back. Laser can help relieve the pain in the lower back. Massage. Hydrotherapy can keep it moving. Therapeutic exercises and neuromuscular stimulation can help maintain the muscle in the back. TENS machines are another way of helping relieve the pain in that back. So there are a lot of therapies that can be used. The tricky thing is finding somebody that can guide you through that.
Yeah.
And I think, that's the difficulty is finding someone. But they are out there.
Definitely.
Yeah.
I think what's really nice about the way you've explained every scenario that's come up in the comments is that it's very much an approach from everyone. It's the owner, the vet, and the rehab therapist to create a kind of this multimodal. And it's just, it is really nice to re-emphasize that it's things that you can do at home, adaptations you can make, plus the therapies, plus the pain relief, etc. There's so much that we can all use together, but it is all of us together, which is just a really nice way to kind of reinforce that message, for sure.
Yeah, this is a team sport.
Definitely.
I mean, it really is. So one person on its own doesn't make doesn't make enough of a difference.
Yeah.
So if you're just going and getting acupuncture and not doing the exercise at home, it'll help a bit, but it won't make a big difference. And definitely, this is why I keep adding other therapies, because multimodal analgesia is the key. Each bit does a little bit more.
Yeah.
And, supports the animal a little bit more. So, ramp the pain down, whatever way you can. Medications, acupuncture, laser, ultrasound, hydrotherapy. But ramp up the exercise within the animal's capability. Okay. Yeah. So you've got to be doing the therapeutic exercises at home every day. Now, what I love is the innovation of our owners. I came across a little video from a dog we treated during lockdown. Little Scotty. Hi, Helen, if you're out there. And it just made me giggle, because obviously in lockdown it was quite difficult. And
so challenging, yeah.
So challenging. But, Helen had created this gym at home for Scotty. Aww. So Scotty had surgery on her kneecap, but she carried her little leg for so long before the surgery that despite the absolutely excellent surgery was perfect, she wouldn't put the leg down.
Yeah.
So we had to go, right, Scotty, that leg is no longer sore. We've got to persuade your brain that leg is working again.
Yeah.
And so, we provided some meds, and we started off very gently with massage and acupuncture and hydrotherapy. But then it was really down to Helen. Right, Helen, you need to get Scotty using that leg. Here are some exercises you can do. And so, in this little video, she was stepping over broom handles as cavaletti. She was walking between sticks for the weaving. She was on a gym ball, bouncing on a gym ball. She was walking on her hind legs, and they'd used the wall in the garden. And so she was walking on the wall, up the wall in the garden, really to strengthen these hind legs. So Scotty didn't know she was doing her gym. Scotty was having a ball, literally having a great time, you know. And that's the thing. You've got to make it fun. It's really, exercise is boring for all of us if it's not fun. So yeah, that's what we try to do. We say, here you go. This is what we need you to do. These are the areas we need to focus on. We need to improve the range of motion of this joint. We need to improve the muscle mass in that area. We need to improve the sensation of where that paw is for our spinal cases. This is what we can do. And, you know, we might have clients using wobble cushions or, you know, various bits of equipment, or just using what's in the home. And again, during lockdown, I found that really useful, because you weren't able to see people in person, but you were phoning them and saying, oh, you see that sofa? Get them to put their front feet up on that sofa and just walk along it on their hind legs. Oh, the steps, you can use the steps. Oh, great, you've got a hill in the garden. You know, it was really an interesting, I don't want to go back there, but it was, it added another element to what we could do, because you suddenly became aware of, you know, why don't we utilize what's in the home more? And also, you know, your advice. Oh, do you know what? That floor is too slippy. If you don't cover that floor, it's just going to re-injure itself. Definitely. You know? So, and why don't you use a ramp for that area? You know, so, and why don't you raise the food bowl? So all of these different things, there's so many things that we can do to make a difference. But yeah, it's a team event. It's a team event. We're constantly putting our clients to work. And, you know, it's like everything else. What you put in, you get out.
Definitely.
Simple as that.
Yeah.
You know.
I've just got one more question. So Catherine says, despite treadmill, hydrotherapy and physio every 3 weeks and 3 walks a day, my 10-year-old dog is losing muscle mass on his quadriceps particularly. He won't tolerate range of motion stretches. He does sit and stand exercises at home, but have you got any other recommendations? He's on Librela, U-Move, and NSAIDs when things are bad.
Yeah, I think if we were losing muscle mass in the quadriceps, I'd be looking particularly at our stifle to see, just to make sure that there wasn't a cruciate strain or rupture going on there. Because what happens, the quadriceps is very important in extending our hind limb, but when the cruciate ligament ruptures, it exaggerates the injury. And our hamstrings are, opposing it. So basically, the quadriceps gets switched off and starts to waste. So I'd be looking really at the stifle. And it sounds like they're doing all the right therapies, but you might need to do to really get a good look at the stifle joints, see if there's anything else that needs to be done there, be it surgery or intra-articularly, and potentially looking at other exercises for the quad, maybe even some muscle stimulation of the quad.
Yeah.
And also just checking that there's not something going on in the spine, the lumbosacral area or the hip. Yeah. These are the tricky things in our older animals. It's very often not just one condition. It can be a multiple of things going on at the same time. So you can have arthritis in joints, you can have lumbosacral disease, hip dysplasia, you might have had an old injury to the carpus in the front leg and the cruciate surgery in the hind leg. And, it's, it's always a challenge. But your old age is a challenge, as I'm finding.
No, definitely. But no, and as you sort of said, compensatory injuries can then be added into the bigger picture as well. So yeah, for sure. So I know that you've kind of already mentioned that things are definitely improving in the amount that we're using veterinary rehabilitation, we're referring out, etc., and clients are becoming more aware of their options in terms of therapies. But where do you think veterinary rehab is going to progress to?
Yeah, well, I think it'll be quite an exciting time in the next few years. I think we're going to have a much greater range of ways of measuring both pain and gait analysis. I think I can see that really changing and becoming easier to do. and cheaper to do, hopefully, in the future.
Yeah.
You've had Greg on with his lovely gait treadmill, and you've got Drew, on. You've got Greg on next week, and I think that he'll probably talk more about the intra-articular injections, because I suspect that that's going to become more relevant. I think that in the future we will be able to diagnose the lameness earlier and treat earlier. So in the equine world, they treat arthritis much earlier. The problem we have in dogs is that it tends to be developed and advanced before it's diagnosed.
Yeah.
And what I would like to see is we're diagnosing dogs and cats earlier, and we're treating them earlier so that the condition doesn't progress.
Yeah.
But I mean, Librela has been a wonderful addition over the last couple of years. That's made a big difference. But I think diagnosis of lameness early and treatment with intra-articular, and also I think the fascium, the myofascium, is going to become more significant.
Yeah.
I was taught very much in a compartmentalized, this is this muscle and this is what it does. This is this bone, this is this joint. These are x-rays of these areas. Everything's connected. And that's what we often forget. Whenever I'm presented with a cruciate surgery to rehab, I don't go to that operated leg. What's happening in the rest of the body? Because, the leg is the obvious thing. If you go to that, you'll miss something else, So, I think the myofascium is going to be interesting. I'm hoping to learn a bit more about it at the end of the year.
Yeah.
So, intra-articular injections, I think, will be interesting. I think shockwave is going to become more common use as well.
Yeah, definitely.
Yeah.
One more question has just come in just before we finish. Sarah said, what's your thoughts on CBD oil on as a pain relief?
That's a whole day's lecture. Give me 2 seconds. I've got to blow my nose again. Sorry.
No, you're fine.
Cool.
I know you were saying to me previously that you've kind of done a chat with Hannah from CAM about CBD. So
my thoughts on CBD are this. It is, so for people, it's not regulated. So anybody can go out and take CBD. That is because you can give yourself consent to take something.
Yeah.
The whole CBD market is massive. It is not regulated. And surveys repeatedly show us that the products either don't contain CBD, they might contain THC, which is the illegal bit.
Yeah.
And the thing that we need to be aware about CBD with dogs is that, or THC rather, is that dogs are much more susceptible to the effects of THC, particularly their cerebellum, which is the balance center. So they're much more likely to fall over, get stoned.
Yeah.
So the point I'm making is that the products, and they can look like a very shiny shop, very shiny website. The surveys show that even very expensive products in well-known high street shops might not contain CBD, might contain toxic substances because of the way the plant grows. It accumulates toxins and chemicals. So it has to be prepared very carefully. So the challenge we have is knowing whether a product is safe to use. And the Veterinary Medicines Directorate, very wisely, I think, have made CBD in animals a veterinary medicine. This means that it can only be given to an animal on veterinary prescription. And I think that's quite important because I don't think the research is at the point yet where we know everything it does. And I think that we just need to be a little bit careful. We need to have confidence in our products. And I think that that hopefully is starting to improve. But having said all that, I think it's very exciting. I think the future is really interesting. Once we as vets are only allowed to prescribe CBD for a patient once we have used all of the licensed, that's the tested medications.
Yeah.
Because it's an unlicensed veterinary medicine. It's classed as veterinary medicine, but an unlicensed veterinary medicine. So for arthritis, we have to use the licensed products. For animals, so we have to use non-steroidals. Then we have to use the licensed products for arthritis in people. So gabapentin, amantadine, parasite, all of those licensed products. And only then, when the animal has, we've tried all of those, only then can we add CBD. So that's what you've got to appreciate, is that legally we are restricted. And there's a very good reason for that, because we don't want your pet to get a product that might cause it harm.
Yeah.
And so it comes down to us to find a product that we have faith in. And really, at the moment, there's only a couple of products in the UK that I would prescribe. And we do prescribe them. And when we prescribe them, a lot of our older patients, we felt, for pain, they do get benefit.
Yeah.
But I do think it's very important that, I think it has its place, but we have to respect that place. So giving it at the start is not appropriate.
Yeah.
We don't fully know yet what all of those effects could be. I think honestly, I think that that's another growth area. I think in a couple of decades, they will probably have worked out, which versions of CBD, CBDA, CBDG, or whatever, are good for arthritis. I think that for a particular type of cancer, they'll say, oh, well, use this mixture of these different CBD, these different cannabinoid products, and possibly some terpenes and things. So there'll be different recipes of different combinations of the cannabinoid products for different conditions, but we're not there yet. The research is at a very early stage, and so it's not safe to use it in an uncontrolled manner. Definitely. So I would say, be very careful what you're taking yourself, and be very careful what you give to your pet, and talk to your vet about it.
Yeah.
But please respect the fact that that they're not legally allowed to prescribe it as a first off medicine. We are doing our best. So Longview Veterinary Education, that's Sam Lindley and the Western Veterinary Acupuncture Group, we do regular events on CBD and other lesser known products for vets and nurses. So we are getting the education out there.
Definitely.
But legally our hands are tied, just prescribing it widely. And I think that's appropriate. I don't think we can just use it widely just yet.
Yeah, for sure. No, thank you for that. And one last question that I just have. Do you have a favourite therapy of all the therapies that you are involved with?
That's easy. Acupuncture.
Yeah.
Acupuncture rocks. I love acupuncture. All these years later, there is nothing gives me better pleasure than popping a few needles into a patient and seeing it go to sleep.
Yeah.
This is nuts. That's nuts. I was a GP vet for 13 years. I stuck needles in dogs all the time. They never got sleepy, except if it was an anesthetic, obviously.
Yeah.
But you know what I mean? It's like, I put them into acupuncture points and they get sleepy. Now, they don't all get sleepy. There's a small percentage that get sleepy. But Emma, our nurse, she put a lovely post up this week, I think, on our HolisticPet Pain Management and Rehab Facebook page. She put it up, and just lots of pictures of our sleepy patients.
Yeah.
And it's just so effective. And, so safe to use. When you know what you're doing, it's really safe. It's really effective.
Yeah.
And no, I love it. I'll be using acupuncture, till I die, till I can't.
Yeah.
That's the one thing I won't give up. You can take away all my gadgets, that's fine. But acupuncture and telling people what to do with exercise, for me,
definitely.
That's the rock that the practice is built on.
Yeah, for sure. Oh, thank you so much. It's I think it's been really helpful. And again, sort of as we've said, to bring together all of the aspects of treatment, and just to remind owners that there's loads that we can do, because it's not just pain relief. So I think that this has been really informative, and that's kind of what all the comments say as well, that it's been really insightful and interesting and informative. So thank you so much. Just from sort of a CAM point of view, obviously, there will be another live next week. So if you'd like to join us next week on Tuesday the 18th, there'll be a live with Helen Marie Pipe of PitPat, who will be discussing the objective use of pet wearable monitoring in practice for arthritis, and how that can help to manage ongoing pain. But yeah, thank you so much for sort of sharing your knowledge and what you do, and kind of bringing everything together, because I think that is just such an important part of managing pain in general.
Good. Well, thanks very much for letting me ramble on.
Yeah, no, it's been brilliant. Thank you so much.
Okay. I hope it helps. All right. Thanks very much.
Thanks. Bye.
Bye.